Hello, this is Michaela, and welcome back to my conversation. First of all, I'd like to apologize for the length of time it's been since the last podcast. Between the holidays and a minor crisis with my dog, I've just been really busy, and although that's no excuse, that is why I haven't had a new podcast out. So I just wanted to say that and to apologize to everybody out there that listens. I really appreciate you all, and I will do my best to not have such big gaps. So I have a couple things I want to talk about this week, and I've had people ask me all kinds of different questions, and I am by no means an expert on any of this. I just know, just what I know. So anytime that you're not sure about something and you think you need a doctor's attention, then that's where you should go, is to your doctor, because I am not a doctor, so I probably won't have the answers that you need. But moving along, I've actually had a couple people mention that they have issues with their cycle as well, and would inducing help them. So I know I talked about it very briefly in the first episode, but let me tell you a little bit more about me. I was diagnosed finally with menorrhagia, and basically it's just a fancy name for heavy bleeding, and that's because of benign tumors, fibroid tumors that I have in my uterus. Now, menorrhagia, there we go, menorrhagia affects 3 million women in the U.S. alone every year. That is a lot. And there are a couple of ways to tell. If you go to your doctor, they're going to ask you questions like, how many pads or tampons do you go through in a day or in an hour? I was changing probably every hour. It was just really bad for me. And my cramps were really bad. I couldn't function, in polite society. And there are other things that can trigger heavy flow. So your doctor will go through a cycle of tests with you to try and figure out. But some of the things that they look for is, like I said, using more than one pad or tampon in an hour, bleeding that lasts longer than a week, needing heavier protection to contain your flow, like if you go from a medium pad to a heavy overnight pad, or from a medium tampon to a heavy tampon, those are signs that your flow is changing. Blood clots that are larger than a quarter. I know that sounds really gross, but sometimes you have to look, and if you're passing really big blood clots, then that's not okay. So you should see your doctor if that's going on. There's general tiredness and fatigue during your cycle, but if it's like out of control, tiredness, fatigue, even shortness of breath during your cycle, those are all things that the doctor looks for. And although I wasn't anemic, my iron levels were really low, so I was on an iron supplement to help with that. So that's what I have. And that's what I controlled with the induced lactation. That I got it under control by essentially fooling my body into thinking that I was going into menopause. I'm older, so all my hormone levels were, different than a 20-something. And I just, you just kind of fool your body into thinking that it doesn't need to do that anymore. So it just stops. Now, will that work for everybody? I don't know. I can say try it. If you are in a position like I was in, and you are at your wit's end with your doctor or with pain or, any of that stuff, then it can't hurt to try. So I would suggest that, you give it a try for a couple of months. And if it doesn't help with what your situation is, then that's obviously not the answer for you. But, I can't say that it won't work either. It's just up to you to try it and see what your body does. I do want to say that I do know women that continue to have their monthly cycle even after they induced. So, it's not a surefire, this is going to stop your cycle completely because, everybody's body is different. So keep that in mind when you go into this. And if you start it and it doesn't change your cycle, maybe it's still going to be something that you enjoy or want to continue doing. So moving right along, I am really surprised the amount of women that I have talked to that don't actually know what a letdown is or milk ejection from your ducts. That really surprised me that there's confusion or lack of knowledge. So let's talk about that. What exactly is letdown? Letdown is simply the release of milk from your breast. It's a reflex that happens when nerves in your breast are stimulated. There's a signal that goes through your system to release oxytocin. And oxytocin is the hormone that prompts the tiny muscles around the milk-producing cells to contract, squeezing milk into the ducts. That can take anywhere from a few seconds to a few minutes. The letdown reflex is a pretty powerful thing. It can be triggered by not just suckling, but also sexual contact and psychological factors. Most women describe letdown as tingly, kind of like a pins and needles sensation, or maybe a warm flush. You might even feel calm, maybe a little relaxed. You might get a little sleepy, and you'll definitely feel thirsty. I remember my first letdown. It was like this warm flush. It just washed over my body. It was probably one of the most amazing things I've ever felt in my life. And I've never had a letdown like that again, but it was an incredible feeling. And all those feelings that you feel, whether it's the pins and needles or the tingling, all of that is actually the milk making its way through the ducts to your nipples. And even if you're inducing and you haven't started producing milk yet, getting that tingly feeling is part of the process. It's your body, those ducts contracting and moving. There may not be anything there yet, but they're working hard to get it there. Now, not all women feel anything when the milk begins to flow from the breast with the letdown reflex, but you'll notice the change in the pattern of suckling. Okay, let's recap. That letdown is a tingling or pins and needles in the breast. You might also have a feeling of sudden fullness, milk dripping from the breast, change in suckling pattern. That's the biggest one. Even if you don't feel anything, there's definitely going to be a change from a quick suck to a rhythmic suck swallow pattern as the milk begins to flow. And you may even feel vaginal cramping or contractions. Maybe it might feel a little bit like menstrual cramps. You may also notice signs of letdown when you're not suckling or pumping during a shower or even sexual activity. You might start to feel that fullness, or milk might start to drip. It's stimulating your breasts in any fashion could cause that to happen. When someone suckles at your breast, tiny nerves are triggered, and these nerve impulses cause the prolactin and oxytocin to be released. I know I said that earlier. The prolactin will increase milk production, while the oxytocin helps to push the milk out, assisting with the flow of the milk. Oxytocin does this by widening the milk ducts and making it easier for the milk to flow through them. The release of the oxytocin may also cause headaches, nausea, and thirst. Everybody's different. Everybody's body responds differently to hormones and how they're released within their system. And it's true, I've had, a couple women say to me that they don't feel let down anymore, that they did at the beginning, but they don't now. And that's normal. Experiencing letdown may stop altogether after the first few months. That doesn't mean that the milk isn't being released. That just means you're not feeling it anymore. There's also such a thing as overactive or fast letdown, which actually happens to be something that I have. And an overactive letdown is when your breast milk comes out hard and fast. And when my milk lets down, It's like a grunt. I can't even explain the sound that involuntarily comes out of my mouth. But it's like a punch in the stomach, but not so hard. It's just really abrupt, and I can feel it coming. It's also oftentimes associated with oversupply, but that's not always the case. And the more milk that's stored in the breast, the more pressure there is, making letdown seem like a fire hose. So, if that's something that you have an issue with, then some of the signs to look for an overactive letdown is engorgement, continuous leakage, nursing pain, gulping, and fast swallowing. And I can definitely hear the difference with my partner after my milk lets down because I feel it. And, he goes from a like normal sucking to gulping because he's having a hard time keeping up. If that's the case, if you have that issue, sometimes it's better to take the breast away and I know it sounds awful, let a little bit of that milk kind of just drain out and then resume suckling because it can be hard to keep up with. But I mean, it's just, it's kind of weird to feel that. And then there's also such thing as dysphoric milk ejection, which, this makes me kind of sad, really. I hate that somebody could be feeling this. Dysphoric milk ejection is an emotional drop that occurs in some women just before milk release, and it only lasts for a couple seconds or a couple of minutes. But some of the symptoms is 3 distinct and different emotions: depression, anxiety, and anger, and the intensity varies from women to women. Dysphoric milk ejection is not related to postpartum depression or aversion to breastfeeding. It can happen to anyone, and it's specific and abrupt psychological reflex are just around the milk release. That's it. And women who experience this feel fine otherwise. It's only during the letdown. And from what I read, there's no definitive answer as to what causes it. There is thoughts that it's a psychological cause or, could be physical and chemical that occurs in the body. It's also been linked to a drop in dopamine that occurs when the milk is released. During letdown, when the chemical prolactin is released, your dopamine levels drop. There's speculation that during this particular time, your dopamine levels drop so low that it's, unusual, and the person may be more sensitive to it. For just a couple of minutes, they have those anger issues. Or I read about one lady who said when she had milk let down for like 3 minutes, she was nauseated, and then it just went away. Everybody's letdown reacts differently. Most people with dysphoric milk ejection usually find that their symptoms gradually reduce, sometimes disappearing as time goes on. But for some symptoms, that they don't completely disappear until the people are no longer producing milk. So if you think this is an issue for you, a good place for info is d-mer.org. And they have a lot of good information there that, might be able to help you. So let's talk about supplements for a minute. People ask me a lot of questions about supplements. Really only take a couple, so I can't always answer the question that they ask me, but I can tell you what I know about the ones I take. So let's start with moringa. For people looking to increase their breast milk supply, moringa is a safe organic way, and one of the answers may lay with the moringa tree. It's native to Asia and Africa, and it has been used as a cure-all since ancient times. It's been acknowledged as the most nutrient-dense food in the world. The leaves of the moringa tree are rich in 5 essential vitamins and minerals, including iron, calcium, vitamin A, E, and K. It also is a complete source of plant protein with all 9 essential amino acids, and it's very high in fiber. For breastfeeding mothers, the moringa tree or the leaves have been scientifically proven to increase the breast milk supply. Moringa leaves are a natural galactagogue. In 2013, the Philippines Journal of Pediatrics published a report which reviewed the findings of 5 scientific studies examining moringa and its impact on breast milk. The report reviewed all published data from 5 small randomized controlled studies and found that moringa products produce an increase in breast milk volume compared to placebos. A second study evaluating the use of moringa to increase the volume of breast milk among mothers with preterm infants had similar results. There are also no known reported side effects of moringa. Sorry, I'm having a tough time with my tongue this evening. The recommended daily dosage is approximately 250 milligrams twice a day. That's what I take. I take 250 milligrams in the morning with breakfast and 250 milligrams at night before I go to bed. And I'd just like to add in here that in addition to helping with the breast milk supply, the moringa plant is it's good for you. They use it to fight childhood malnutrition. Mothers in Asia and Africa eat the moringa leaves during pregnancy and after birth. There's just a lot of benefits to it. My doctor did some blood work not too long ago and said to me, I don't know what it is that you're doing, but your blood work looks amazing and keep doing it. Even if you don't take it to increase breast milk, moringa is a good supplement to add to your vitamin regimen or whatever it is that you may be doing. I also take shatavari, which is a medicinal plant native to India and the Himalayas. It has been used as traditional Indian medicine for more than 5,000 years. The healing properties of shatavari is mainly owing to the presence of bioflavonoids. It also contains essential minerals like zinc, calcium, and B vitamins. Shatavari is good for improving your overall health. Shatavari is really good for female health. If you are trying to conceive, if you're having fertility problems, any of that stuff, the rumor is or the story is that shatavari can help with that. Those things I can't say because my days of having babies is long since over, but shatavari is supposed to be really good for women's health in general. It boosts the immune system. It helps fight off various forms of infection. It provides relief from common digestive problems like diarrhea, heartburn, inflammation of the digestive tract, and it also has antidepressant activity that may help with depression. Various research studies have been conducted to understand the role of shatavari in increasing milk production. It has been found that it stimulates prolactin and corticoids, which are mainly responsible for improving both the quality as well as the quantity of breast milk. There's also evidence that suggests it also promotes secretion of steroid hormones that can increase breast weight and ensure higher yield of breast milk. The recommended dosage is 500 milligrams twice a day, and that's also what I take. I take 1 in the morning and 1 in the evening. If you are taking shatavari to increase your milk supply, one thing I want to tell you is don't expect that it will increase it overnight. Because with shatavari, it's one of those things that you have to get into your system. So you have to take it continuously for several weeks before you'll really see any results. If you add it to your vitamin regimen and, by the end of the week, you're not really seeing a difference, don't stop taking it. You got to give it some time to let it work with your system. It's a natural substance and it has to be absorbed and processed through the body first. But once your milk supply does improve, don't stop taking it either. And my disclaimer here, as with any other herbal supplement or anything that I talk about, it's always advisable to talk to your doctor before you start any of it. Goat's rue, that's another one that I take. It's a plant native to the Middle East, Southeastern Europe, and Western Asia. It is commonly used to treat diabetes, inflammation, and fever. And goat's rue has been used for years to treat diabetes. So, there's something good there somewhere. It's also used for developing mammary tissue. Goat's rue stimulates the development of the mammary tissue. It has been used to increase breast size in non-lactating women. It may also induce the growth of breast tissue in women who have had breast surgery or plan on nursing or adopting children. It helps promote tissue growth in women whose breasts didn't increase during pregnancy, and it may facilitate letdown so your body can release the milk easier, and it helps maintain breast health. It lowers insulin and blood sugar levels. It has been used in diabetic patients to reduce blood sugar levels since the early 1900s. I said that. It's been around for a while. It's a diuretic. It's also it has antibacterial properties. It protects the liver. It helps fight obesity. Something that I just want to put out here, just in case people don't know, is some of these plants in their natural state or raw form are toxic, and goat's rue is one of them. So, only use or take the dried plant form. Never, eat, I guess, the live plant, or, pick a leaf and eat it. It's toxic, so don't do that. The normal dosage for goat's rue is 1 capsule 3 times a day. And that's, again, how I take it: breakfast, lunch, and dinner. And that also, if you take goat's rue along with a calorie-restricted diet, it will help you to lose weight. It has an amazing anti-obesity agent. A high-calorie diet without exercise causes weight gain as well as fat gain. There's something in the goat's rue which at the moment escapes me. I just had it on the tip of my tongue. But anyway, it's responsible for the weight loss effect. It suppresses the appetite and delays hunger pains. So less calories enter the system, which may help to lose weight. It also may prevent the storage of fat in the body and help with fat burning. So that's, another good thing to know. Anyone with low blood glucose levels should avoid goat's rue, though. The plant has a strong hypoglycemic agent, and taking goat's rue may further reduce the blood glucose levels. So that's something to keep in mind. Now, the last thing I want to talk about, and I've had so many emails and messages and, people talking to me about domperidone. And before I said I wasn't going to talk about it because it's actually not something that's legal in the United States. But I've changed my mind on that, and I do want to talk about it a little bit because I know that there are people that take it, and people that want to take it, and people that are curious about it. So I'm going to talk about it a little bit. First of all, the FDA banned the use of domperidone in the United States. Why? There's a lot of people that want to know why. Well, in 2004, 2 people died. So the FDA decided that this medication was not a good medication to have on the market. What they didn't tell people, or what I guess the information is out there because I found it, but what they fail to, put out there for everybody to see is that the people that died from the domperidone was given large amounts of intravenous domperidone, which is no longer used and was never used for enhancing milk supply. These people were given huge doses, and the patients were sick with other problems, most notably cancer. And domperidone was being used for the nausea and vomiting from the chemotherapy. Now, the speculation is that it's likely the combination of huge doses of dom intravenously plus other drugs like the chemo and, whatever else they were giving them, is what caused the problems and ultimately the death. The FDA has led people to believe that these are new cases, when in fact they are several decades old. Several medications have as side effects the production of breast milk. Domperidone is an antiemetic or anti-nausea drug that was initially prescribed for people with upper GI problems. Domperidone is not a hormone. It just has the side effect that results in the increase of prolactin levels. Domperidone is not known to cross the blood-brain barrier in significant amounts and is used to treat chronic conditions that require long-term use. And I know that in other countries they use domperidone a lot. And I read a couple of different articles about doctors who were frustrated from other countries as to why women in the United States were not given access to this medication as a way to help them enhance their breast milk supply, especially new mothers who, may be struggling or having issues. I also found out that the American Board of Pediatrics actually encourages the use of domperidone for new moms to help increase their breast supply, or not breast supply, milk supply. Sorry, it's getting late. Milk supply, so that they can continue to nurse their babies. And there is so many health benefits for both mother and babies during nursing. For any women, I don't know if I've said it already, but there is studies that show nursing or suckling helps prevent breast cancer. So why wouldn't you want to encourage mothers to do that? Breastfed babies are less likely to be obese. It helps fight off childhood diabetes. There are so many benefits to kids that are being breastfed that being able to give them the opportunity to increase their milk supply, I'm sure is very frustrating for some doctors. Okay, sorry. I got off on a tangent there. Domperidone isn't available in the United States except at a few compounding pharmacies. However, it is perfectly legal for a United States doctor to prescribe domperidone even though it's not available. It is also legal for a U.S. citizen to bring it into the States, providing they have a prescription, a letter stating it's for personal use, and does not exceed a 3-month supply. So, ladies, if you do get it and you have it, ordered or brought into the United States, you're not going to go to jail for having it. Just let me put that out there. The maximum dose should not exceed 20 milligrams 4 times a day. It is suggested that you start with 10 milligrams 4 times a day for 1 week and then increase gradually. You should continue the DOM from initiation of lactation until you decide to try. Once lactation is fully established, you can consider slowly decreasing your dose. If your supply suffers, you can always go back. Okay, so how long can you use DOM? Well, worldwide experiences with DOM over at least several decades suggest long-term side effects are rare. Patients using DOM for stomach disorders may be on it for many years if it's necessary and helpful to stay on it. Now, one of the questions that I've gotten is how long does it take it to work? Well, that all depends. For some, DOM works quickly, sometimes within a day or two. For others, it may take up to a week or more, and there's the rare occasion that it takes a month. Most doctors recommend you take it for a minimum of 6 weeks to be sure whether it has worked or not. And it's also suggested that it's, very important to stop the DOM slowly. Decrease to 20 milligrams 3 times a day for 2 weeks. Then 10 milligrams 4 times a day for 2 weeks. Then 10 milligrams 3 times a day for 2 weeks. 10 milligrams 2 times a day for 2 weeks. And then 10 milligrams once a day. When you get down to once a day, then you can stop. All right, so that's my conversation for this evening. Thank you for joining me. I hope you found it enlightening and helpful. If you have any questions or there's something you'd like me to talk about, please feel free to let me know. Otherwise, I hope you have a great night and thank you for listening.